my dressing change and pushing medications through a central line. So first thing I'm going to do, I'm going to have my patient be masked, turn his head, and then I'm going to be washing my hands. I already have my mask on, and I'm going to remove the old dressing. And I also want to get my supplies together and check the expiration date as well. So I'm going to lightly try not to pull his hair off. Okay. I'm going to discard that. Then I'm just going to be assessing the site, make sure there's no signs for infection or anything like that, and it looks pretty good. So now I'm going to take my gloves off, perform hand hygiene, and then I'm going to come up here and set my sterile field. So make sure I'm not going to turn my back on my sterile field. Okay, my hands are clean. Okay, so now I'm going to put on my sterile gloves. Okay, now I'm sterile. So the first thing I want to do is I'm going to take my floor prep, and it's per policy for which how they want to clean their lawn. Alright. Well, I'm going to let that dry, and then I'm going to go ahead and put on the thing. And then I'm going to take my Mepilex. That is done, and then I want to name and date it, and then I'm going to go ahead and chart it. So I'm going to clean up my mess. And then I am going to check the orders of medication, perform hand hygiene, get a new set of gloves, use the 11 nights of medication, and I am going to administer medication. And then the first thing I want to do, I'm going to take a flush, and then I'm going to aspirate, and I would want to aspirate this a little longer because where it's a longer lumen. So I'm going to take my alcohol swab, I'm going to clean it off, take my flush, clean off the alcohol swab. I'm going to aspirate for blood return. There's blood return, and I'm going to go ahead and flush it. Then I'm going to take my medication. I'm going to make sure it's the right medication. I'm going to check the orders. Then I'm going to go ahead and push it at a slow, even rate. Then before I would push this medication, I would clean it with alcohol again. Okay. And then I'm going to take a new flush. I'm going to flush it again. Use alcohol pad to clean it. Put a new head on it. Then I'm going to document that I gave him his medication.